the weekend, Valentine's Day, how to celebrate, what gift to buy. These are all thoughts that have consumed many people's minds this week, but my thoughts have been consumed by my cousin and her battle with leukemia. My goal today is to inform you all a little bit more about acute lymphoblastic leukemia, also known as acute lymphocytic leukemia, or ALL. I am credible to speak on this topic because I have done a lot of research about this particular type of cancer. There are a lot of different pieces that make up this terrible disease, such as the cause and how it is diagnosed, risk factors, signs and symptoms, places for treatment, and the treatments and their side effects. First, I will tell you what ALL is, what causes it, and how it is diagnosed. ALL is a cancer of the blood and bone marrow. It creates immature blood cells and affects the lymphocytes of white blood cells. According to Mayo Clinic, ALL occurs when a bone marrow cell develops errors in its DNA, and the cell continues to grow and divide instead of stopping like a healthy cell normally would. When this happens, blood cell production becomes abnormal. The bone marrow produces immature cells that develop into leukemic white blood cells called lymphoblasts. These cells don't work or function correctly, and they even begin to build up and crowd out normal healthy cells. The causes for these DNA mutations aren't exactly clear, but doctors don't seem to think that these causes are inherited from family. In order to diagnose ALL, blood tests are usually done to count the number of white blood cells versus red blood cells and platelets. According to the American Cancer Society, many of the patients diagnosed with this cancer have too many white blood cells and not enough red blood cells and platelets. Many of those high number of white blood cells are lymphoblasts, which are not usually found in the bloodstream, according to the text Fundamentals of Anatomy and Physiology. Now that you know how this cancer is caused and diagnosed, I'm going to tell you about some other factors that are related to this cancer, such as risk factors for getting ALL and some signs and symptoms that can lead to detecting this cancer. According to the American Cancer Society, risk factors include exposure to radiation and also certain chemical exposures. This particular cancer is more common in whites than in African Americans, and it is more common in males than in females. It also says that it is more common in children, but adults can get it too. Other risk factors include certain viral infections and inherited syndromes such as Down syndrome. Even having an identical twin that has cancer within their first year of life increases a person's risk of getting ALL. There are several signs and symptoms for ALL, and some of them are sometimes confused with the flu. However, the symptoms with the flu usually go away, and when you have this cancer, they do not. According to the Mayo Clinic, signs and symptoms include fever, bone pain, bleeding from the gums, frequent infections, severe nosebleeds, pale skin, shortness of breath, weakness, and fatigue. Also, lumps caused by swollen lymph nodes around the neck, underarm, abdomen, or groin are also common signs. Now that you know the risk factors and signs and symptoms, I will share with you where and how this cancer is treated. There are many hospitals, clinics, and cancer centers that people can go to for treatment for ALL. My cousin was being treated at the University of Iowa Hospital and Clinic, and these are shirts that we got made to show our support for her in her battle. This cancer is treated commonly with chemotherapy drugs like vincristine, which interferes with cancer cell growth and results in the death of these cells. There are many types of chemotherapy drugs that can be used to treat this, but radiation can also be used to maintain or shrink the size of tumors. Along with these treatments come many side effects. Some are very common, like hair loss, nausea, and fatigue. There are also many side effects that many people may have no idea about, like changes in the way that food tastes, joint pain, depression, headaches, and even sight or hearing loss, which is rare but sometimes can become permanent. The list for possible side effects of treatment goes on, and some are much more severe than others. As I stated earlier, there are a lot of different pieces that make up this terrible disease, such as the cause and how it is diagnosed, risk factors, signs and symptoms, places for treatment, and the treatments and their side effects. While there are a handful of types of cancers that are more commonly talked about and recognized, it is important to understand that there are many more types that are affecting people's lives every day, and this is just one of them. I hope you never have to know more about this, but I think it is important to be aware, and I hope after today you understand more about acute lymphoblastic leukemia. Thank you.